Hello everyone, I am NMC Doctor. It is nice to meet you. Today, we talk about when we asked ChatGPT about insomnia guide. Mike Jackson died of insomnia using drugs incorrectly. I loved Jackson so much that I started with this video. Insomnia symptoms with distress or impairment. General insomnia disorder in 10% to 15%. Nearly half of severe insomnia cases last for more than 10 years. So it is important to further evaluate it with chronic insomnia. Let's start with a real example. A nurse has suffered from insomnia for many years. She has been taking Estazolum for 8 years, 8 pills a day, but she still cannot fall asleep. What can we do? Can we have the opportunity to conveniently discuss with doctors from all over the world? First, the Estazolum need to be gradually decommissioned. Second, she needs a thorough evaluation, medication adjustments, and psychological studies. Finally, she recovered. Today we will try to talk about the problem of insomnia, such as asking ChatGPT. We typed in the insomnia guide in ChatGPT, and what we saw were some general introductions, which did not help much to solve this difficulty. Just let's see. For medical staff, or for GPT, it is not an easy problem. Recommend to doctors. First, you need an experienced physician who can consult and discuss. Second, you need to learn a lot. Hopefully, we can discuss more specifically under the video. And I have sent out the guide and links for your reference. Recommend to patients. First, you need to know where to find a good doctor. Second, you need to learn some when you need. A good doctor is at least willing to express himself so that more people can find him easily. He is also willing to communicate with others. He can help others and get help from others. In fact, we are good doctors, waiting for more doctors to participate. We will be better than many people think. There are still many questions about insomnia. First, American College of Physicians (ACP) recommends that all adult patients receive cognitive behavioral therapy for insomnia (CBTI). What is CBTI? But Musk suffers from insomnia and take Ambien. Michael Jackson take lorazepam and midazolam and even propofol. Did they receive CBT? How does CBT actually work? Second, the FDA has approved pharmacologic therapy for short-term use for 5 weeks. And patients should not continue using the drugs for extended periods. But there are countless people who have been taking drugs for years. Third, some recent clinical guidelines do not recommend trazodone use for treating insomnia. But it is one of the most commonly used prescription medications for insomnia. So many kind of pills. Which should we choose? Okay, let's go back to the real world. What should a doctor do when he encounters a patient with insomnia? Dealing with transient insomnia is relatively simple. Some medication is often an option. The FDA recommends that patients with insomnia that does not remit within 7 to 10 days of treatment should be further evaluated. Diagnosis is important for the insomnia. Insomnia-related disorders listed in XR can be considered conceptually in 3 major groupings: sleep-related breathing disorders, medical or psychiatric disorders, psychophysiological. The disease causing insomnia needs to be dealt with, but CBT for the insomnia itself is also needed. Some literature says that 2 to 6 sessions of 20 to 50 minutes of CBT are about half effective, but doctors and patients in many places fail to spend so much time studying and exercising. There is a lot of public information on CBT for insomnia. Only a few patients really understand it. Let us discuss more about how to think and what to do when suffering from insomnia in the future. Have you really mastered it? Going back to the nurse at the beginning, she had no other physical diseases. only some substance hold depression. So within 2 months, she gradually stopped taking estasylum with the assistance of trazodone. Later, trazodone was also stopped. She learned CBT not very well, but finally, her insomnia was completely cured. I think she would need study more in the future. At present, GPT cannot help our doctors too much, but it is definitely a very promising future. I love Michael Jackson. I love AI. I love med. Just let us talk more.